Welcome to Save with CPR's First Aid Training. In this video, we will cover principles of first aid, calling 911, medical emergencies, and traumatic emergencies. First aid is the initial care provided to a person suffering from a sudden illness or injury with the primary goal of preserving life, preventing the condition from worsening, and promoting recovery. First aid is typically administered by a layperson until professional medical assistance becomes available. The principles of first aid include remaining calm, assessing the situation, protecting oneself and the victim from further harm, and providing appropriate care for injuries or conditions. Knowledge of first aid is invaluable as it equips the individuals with the skills to respond effectively in emergencies, potentially saving lives and reducing the severity of an emergency situation. Calling 911 is a critical step in any emergency situation as it connects you with the professional medical responders who can provide life-saving assistance. When you dial 911, stay calm and speak clearly. Provide the dispatcher with your exact location, including any landmarks or cross streets that can help emergency services find you quickly. Describe the nature of the emergency and any specific conditions of the patient, such as unconsciousness, severe bleeding, or difficulty breathing. Follow the dispatcher's instructions carefully as they can offer vital guidance when help is on the way. Remember, timely communication with 911 can significantly improve the chances of a positive outcome in an emergency. Remember, these first aid steps are intended to provide immediate assistance until professional medical help arrives. Always prioritize safety and seek medical attention when necessary. A medical emergency is a sudden and unforeseen situation that poses an immediate threat to an individual's health, well-being, or life. These emergencies require urgent intervention to prevent serious harm or death. Examples of medical emergencies include cardiac arrest, severe bleeding, strokes, choking incidents, and severe allergic reactions called anaphylaxis. The hallmark of a medical emergency is its acute nature, demanding quick and decisive action to stabilize the patient, provide essential care, and ensure they receive appropriate medical treatment as soon as possible. Prompt recognition and response are crucial in mitigating the potential long-term consequences and improving the chances of survival and recovery. An allergic reaction is the body's immune system response to a substance that it perceives as harmful, even though it may not be harmful to others. When an individual with allergies comes into contact with an allergen, such as foods, medications, insects, pollen, or animal dander, their immune system reacts by releasing chemicals such as histamine. These chemicals trigger allergic reaction symptoms, which can range from mild to severe and may affect the skin, respiratory system, gastrointestinal tract, and cardiovascular system. Symptoms of an allergic reaction may include hives, itching, swelling, especially around the face, lips, and the tongue or the throat, difficulty breathing, wheezing, nausea, vomiting, or dizziness. The reaction may be triggered by foods, medications, insect stings, or other allergens. So check if the victim has any known allergies, check if the victim has an epinephrine autoinjector, and check if the victim may have been exposed to an allergen. If you suspect the person is having an allergic reaction, you should do the following things. If the person has an epinephrine autoinjector and two or more signs of an allergic reaction, help them use it immediately according to the instructions provided. Call 911 to start first responders. Then stay with them and provide reassurance until help arrives and to update 911 if anything changes. Pictured is the EpiPen. That's a brand name of one of the epinephrine autoinjectors. The way this device works is you slide it out of the case, you take the blue cap off of the end. You need to make sure that you hold the EpiPen with a closed fist so you don't accidentally leave your thumb over the needle and inject yourself. You'll then take the epinephrine autoinjector, you'll push it hard against the victim's leg as pictured here for at least 3 seconds. After the 3 seconds, you may remove the epinephrine autoinjector, having given a dose of epinephrine. Also keep in mind, they have adult epinephrine pens and they have pediatric epinephrine pens. So make sure you have the right one and it's prescribed to the victim. Diabetes is a complex medical condition that can lead to situations where the victim has too much glucose or sugar in their blood or not enough glucose or sugar in their blood, both with their own set of problems. So recognizing a diabetic emergency is fairly important. One of the biggest signs of a diabetic emergency is going to be altered mental status. You may view that as confusion, lethargy, or the person is unresponsive wholly. Symptoms of low blood sugar, which is called hypoglycemia, may include weakness, confusion, sweating, trembling, rapid heart rate, or loss of consciousness. Symptoms of high blood sugar, called hyperglycemia, may include excessive thirst, frequent urination, weakness, nausea, or confusion. In recognizing diabetic emergency, the two most important things to consider are: does the victim have a history of diabetes? And what is their blood sugar? So, what are the first aid steps for a diabetic patient? If the person is conscious and experiencing symptoms of low blood sugar, suggest that they check their sugar levels. If their blood sugar is low and they are able to swallow, give them a fast acting carbohydrate, such as fruit juice, candy, or glucose tablets. If the person is unconscious or unable to swallow, do not give them anything by mouth. Call 911 and stay with the victim. Difficulty breathing is where somebody is having a hard time catching their breath, getting full breaths, and ultimately potentially getting oxygen. Symptoms may include shortness of breath, wheezing, coughing, chest tightness, or bluish discoloration of the lips or fingernails. Difficulty breathing may be caused by asthma, allergies, respiratory infections, or other medical conditions. When identifying difficulty breathing, it's very subjective, so the ultimate person who's going to report being short of breath is the victim. If a person is experiencing difficulty breathing, there's a few things you can do to assist them. Help the person sit upright and lean forward to assist with their breathing. If the person has a prescribed inhaler or respiratory medication, assist them in using it according to the instructions provided. If the person's condition worsens or they show signs of severe respiratory distress, such as an inability to speak, gasping for air, call for emergency services immediately. Fainting is also known as syncope. It's a temporary loss of consciousness, typically caused by a temporary decrease in blood flow to the brain. Symptoms may include dizziness, lightheadedness, nausea, sweating, or pale skin. If a person feels faint or has fainted, encourage them to lie down, loosen tight clothing. If the person faints, check for responsiveness and breathing. If they are not breathing, start CPR. But either way, call 911 immediately. Heart attacks are caused by abnormal blood supply to the heart. Symptoms may include chest pain or discomfort, pressure, squeezing, fullness or pain on or around the chest, pain or discomfort in other areas of the upper body, such as the arms, back, neck, jaw, or even the stomach. Shortness of breath, nausea, or lightheadedness. Keep in mind, women and older adults may experience atypical symptoms such as fatigue, weakness, or indigestion. If the patient is not allergic, encourage them to take 324 milligrams of aspirin by chewing it. This would be 4 81 milligram baby aspirin. If the person is prescribed nitroglycerin and their symptoms persist, suggest they consider taking it as prescribed. Seizures are caused by disorganized electrical activity in the brain. These seizures can manifest as convulsions, muscle stiffness, loss of consciousness, staring spells, or involuntary movements. Seizures may be caused by epilepsy, fevers, head injury, strokes, or other medical conditions. If you find a person suffering from a seizure, keep the person safe from injury by moving objects out of their way and cushioning their head with a soft object. Do not restrain the person or put anything in their mouth. After the seizure ends, help the person into a safe position and provide reassurance. Don't forget to call 911 for this person. A stroke is caused by inadequate supply of blood to the brain, either from a blood clot or a bleed. Strokes can happen to anyone at any age. The signs of a stroke would consist of numbness or weakness to the face, especially one side of the face. If you have them smile and show their teeth and one side of the face droops down or doesn't have the same strength, that could also be a sign. Confusion or trouble speaking or difficulty understanding speech is another possible sign of a stroke. Trouble seeing with one or both eyes, changes in vision, double vision. Difficulty walking, being dizzy, imbalances could also be a sign of a stroke. Also, a severe headache could be a sign of a stroke. What's called a thunderclap headache with a strong and immediate onset, sometimes described as a thunderstorm in your head. If any of these signs or symptoms present, call 911 immediately. Stay with the person and be with them until help arrives. A traumatic emergency is a type of crisis that results from sudden, severe physical injury or impact to the body. These emergencies can arise from various incidents such as car accidents, falls, sports injuries, or violent acts. Traumatic emergencies often involve damage to bones, organs, tissues, and may result in conditions like fractures, spinal injuries, head trauma, or severe bleeding. The nature of these injuries often require immediate and specialized medical attention to prevent complications, reduce pain, and promote healing. Prompt and appropriate first aid response, such as controlling bleeding, stabilizing fractures, and preventing shock, is essential in managing traumatic emergencies and ensuring the best possible outcomes of the affected individuals. Bleeding is the loss of blood. Bleeding can occur externally from a wound or internally from damaged blood vessels. Signs of external bleeding may include blood flowing from a wound, soaking through clothing or bandaging, or pooling on the ground. Signs of internal bleeding may include swelling, bruising, pain, or tenderness in the affected area, along with signs of shock, pale skin, rapid heart rate, or rapid breathing. The first aid steps for bleeding are fairly straightforward. First, apply direct pressure to the wound using a clean cloth or sterile dressing to control bleeding, or your gloved hand. If bleeding persists, apply a tourniquet above the wound as you'll see in the next video. Call 911 and stay with the patient until help arrives. Symptoms of a broken bone, called a fracture, may include pain, swelling, bruising, deformity, and difficulty moving the affected limb or a grating sensation at the injury site. Open fractures occur when the broken bone protrudes through the skin, while closed fractures do not break through the skin. If you suspect somebody is suffering from a broken bone, immobilize the injured limb to prevent further movement and minimize pain. Apply ice packs or cold compresses to reduce swelling and alleviate pain. Seek medical attention promptly for evaluation and treatment of the fracture. Call 911 to have the victim transported to the nearest hospital for treatment. Burns can result from exposure to heat, chemicals, electricity, or radiation. Burns are classified into three categories. First degree burns, which are superficial. Second degree burns are partial thickness. And third degree burns, full thickness. Symptoms of burns may include redness, swelling, pain, blistering, charred skin, or difficulty breathing in the case of inhalation burns. If you suspect somebody has suffered a burn, remove the person from the source of the burning and cool the affected area with cool running water to stop thermal burning only if the area is still actively burning. Then, remove any clothing or jewelry from the burned area unless it is stuck to the skin. Cover the burn with a clean, dry, sterile dressing to protect it from infection, and seek medical attention for severe burns, especially burns involving the face, hands, feet, or genitals, or burns larger than the size of a palm. Call 911 to activate EMS for a medical evaluation. Thank you for learning about first aid with us. This video serves as a general foundation with some good general principles to approach medical and traumatic emergencies. While we're unable to cover everything in these videos, we hope it serves as a good starting point. Your instructor may take some time after this video to review some of these techniques or different situations outside of this video.